Good day. My name is Georgiana Maruska and I'm going to share my poster with you. First, let me give you some background information. Statins are effective cholesterol-lowering medications that decrease the risk of cardiovascular events. There is a spectrum of statin-induced myotoxicity with an incidence reported in the literature as high as 14%. These myotoxic effects range from myalgias to acute compartment syndrome. Here I'm going to discuss a case of acute compartment syndrome of the left lower leg secondary to atorvastatin use. Our case involved a young man who presented to the emergency room after 4 days of progressively worsening left lower leg pain. Prior to this, he was in his usual state of health. His medical history included hypertension, obesity, and hypercholesterolemia, for which he was started on atorvastatin 3 months prior. He denied any recent trauma or strenuous activity. On physical exam, pain was elicited with dorsiflexion and plantar flexion, and the skin overlying the left leg also looked tense. He was afebrile, had a normal heart rate. X-rays of the left lower leg showed no acute fracture, and labs were notable for an elevated CPK of almost 3,000. Because his pain progressively increased over the course of hours, surgery was consulted. He was found to have elevated compartment pressures, especially in the superior, posterior, and lateral compartments, and was taken to the OR urgently for a 4-compartment fasciotomy. Post-op, he did well and eventually underwent a closure of fasciotomies. He was discharged home with follow-up in the surgery clinic, and of course atorvastatin was discontinued. Looking at a graph of comparing the efficacy of various statins at lowering the LDL, we see that atorvastatin, shown here in black, and simvastatin in green, are among the top 3 statins that have a good reduction in LDL cholesterol at maximum prescribed doses. Both simvastatin and atorvastatin have been reported causing more serious adverse effects such as acute compartment syndrome. When adverse effects such as simple myalgias occur, they resolve with medication discontinuation. However, in the case of compartment pressures, a Stryker needle is used to obtain serial measurements of the various pressures in the compartments. Rhabdomyolysis, which commonly precedes acute compartment syndrome, has been reported in the literature with an incidence as high as 2%. And this graph here on the left shows, as stated before, simvastatin to be a common cause of fatalities as a result of rhabdomyolysis. Behind it is atorvastatin. So again, these 2 statins have been commonly reported in literature causing acute compartment syndrome. So statins do have a beneficial role in lowering the overall risk of cardiovascular disease. When they lead to acute compartment syndrome, that effect should be recognized because acute compartment syndrome is a surgical emergency. It is not always preceded by crush injuries or fractures, and when statins are not tolerated, PCSK9 inhibitors are a good alternative. So to conclude, statins are beneficial. Atorvastatin is a commonly reported medication associated with myotoxic effects ranging from myopathy, rhabdomyolysis, and compartment syndrome. And acute compartment syndrome is a surgical emergency and it should be recognized and acted upon. Thank you for your time.